I'm John Catino, Emergency Management Deputy Director. Today we added 5 COVID-19 cases to the list. The numbers are growing quickly, with more positive cases being identified each day. The Delaware County Health Department is moving to a once daily press release on cases and other information, which will be released around 10 a.m. each day. We are still seeing a lot of unnecessary traffic in our community. If you do not need to go out for food or medical treatment, you need to stay home. The virus doesn't move, people move it. We stop moving and the virus stops moving. It dies. It's that simple. Protect the vulnerable in our community and stay at home. Please take a moment to hear a message from the Chief Medical Officer of IU Health Ball Memorial Hospital.
Good morning, it's Dr. Peter Voss. I'm the Chief Medical Officer for the East Central region of Indiana, which includes Delaware County, Jay County, and Blackford County. So that's Ball Hospital, Jay County Hospital, and Blackford Hospital. Thank you for taking the time to listen in. I wanted to give everybody some updates about what's happening and things to look forward to or be aware of. First, I wanted to thank everybody for the huge outpouring of support we've had from community members, not only from donations, food donations, people making masks, just asking what they can do to help providing meals for tired staff. So it clearly takes a village to get through this current COVID-19 pandemic that we are all trying to work our way through. I also wanted to reassure everyone here at Ball Hospital, as well as at our sister hospitals, both Jay County and Blackford Hospital, are as absolutely prepared as we can be for this and ready to take care of the patients and members in our community. The discussion about having enough supplies, we have adequate supplies and we are ready. We have also been doing drills every day and sometimes 2 and 3 times daily for the last several weeks to prepare for this. The teams feel very supported. We are actively caring for sick people in our community and are doing our best to keep them safe and well. Some of the things you may have been hearing about is it business as usual for hospitals? And the answer is not business as usual, and that all elective surgeries have now been canceled for several weeks. Anybody with urgent issues is to be contacting their doctor and is still getting the emergent care they need. The emergency room is absolutely ready for anyone having true medical emergencies, so we do not want people to stay home unwell or unsafe. So the other thing is that if people do have concerns in the community, to please reach out and call their primary care doctor, call their clinics. The clinics are still open, particularly for phone calls, and a lot of visits are virtual visits. There are occasional scenarios where somebody does still have to be seen, and the offices are equipped and ready throughout the community. If they have to have a patient come in to have care, please don't delay needed care. So those are really important things to remember. The other things to think about from a community perspective: how can we help? How can we get through this? I cannot emphasize enough, the most important thing is to stay home and take care of yourself and your loved ones. And hand washing is probably the key to all of this. And hand washing doesn't mean just a little bit of water, doesn't mean you have to have an expensive hand sanitizer, just some good soap and water, but washing for at least 20 seconds. That is much longer than most of us would normally do that, and do that frequently. Our infectious disease specialist said wash your hands 100 times a day. So that is the key. And also to do a regular daily cleaning around the house with a disinfectant or otherwise soap and water. Frequently touched surfaces. So many of us have laptops and cell phones and countertops that we need to pay attention to. The reasons to be out: clearly people will need medications, clearly people need groceries. So there are times, practice social distancing if you're out, to stay at least 6 feet away from people. And if you're otherwise well, it is okay to be outside. It is okay to get some physical exercise. It's good for mental health as well, to go out and take walks or otherwise keeping your distance. But otherwise, this is not time to go to friends' houses for sleepovers and to do other unnecessary things. I cannot emphasize enough, the most important thing that we can do besides the hand washing and cleaning around the house is to distance ourselves from those around us. That is not our typical culture, but that includes protecting those that are at risk. For us, that may be an elderly parent, somebody that has other health issues. We are not to go over. We can check on them via phone. We can do grocery shopping for them. We can drop them off in the door. We want to avoid going into their homes. We still want to tell them that we love them, we support them, and we want to make sure they have access to care. Those are some of the highlights. We are in the midst of an entire village battle against this COVID-19 virus that all of us are learning about every day. There are changes coming every day, but we feel as ready as we can be, and we very much appreciate your support.